Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Monday, April 27th, and this is my daily briefing. We've had no changes in cases in Missoula County as of right now. We're still holding at 41 cases. 39 of those cases have been identified by testing, and 2 were epi-linked. We've had over 30 recoveries and 1 death, and there are still 9 people that are currently in isolation with active COVID-19. The state has had a total of 449 cases and has had 14 deaths. I don't want people to think that since we haven't had a change in cases in a few days that COVID-19 is gone. I want people to recognize that the social distancing measures that we've put in place have worked, and we want to be smart with our next moves so that we don't waste our community's hard work and sacrifices. So I want to talk a little bit today about Missoula's reopening plan. I want to thank the people who have shared their feedback on the reopening plan. We've received hundreds of responses through our online portal, as well as emails and phone calls. The overwhelming majority of the responses support moving forward more slowly. We appreciate the business owners and employees who have reached out while we reviewed the governor's plan. There were very few who expressed confidence that they were prepared to reopen right now. Most were concerned about how they could practice social distancing with their business and wanted some additional guidance and some time to get prepared. This group did include salon owners and stylists, as well as retail operators. The decisions that we made were not arbitrary. The businesses not allowed to open until phase 2 were all jobs with close physical contact and no way to social distance. The non-essential businesses, delayed 4 days from the open date of the governor's order, were still allowed curbside service until they could figure out how to support social distancing and employee and customer protections within their stores. Essential businesses that have been open were asked to step up the protections for long-term prevention. The section on limiting group sizes was to prevent congregation and to stop the virus's ability to take off again in large groups of people. If you remember a previous daily briefing a little while back, Missoula made this mistake during the 1918 flu. They got the virus under control, and then it took off again because of large groups of people congregating downtown. The evidence shows that gradual reopening is the best way for us to control a disease like this. It's also better for business owners to have the time to prepare and have the guidance and good information prior to opening. Opening all at once doesn't mean the economy is instantly going to recover. If people and employees don't have confidence that things are safe, the economy is not going to wake up even after things are open. If we work together to figure out the right approach, we're not only keeping the illness numbers down, but we're building confidence and providing a long-term strategy. We don't want things to have to get closed back down again. We don't want clusters of illness associated with businesses. This would affect not only the spread of the disease, but also consumer confidence. We also just want to point out that we did not go as stringent as many Missoulians wanted. We got many requests to continue the shelter in place, and we had many that asked us to keep restaurants closed for dining and keep non-essential businesses shuttered. We appreciate that many of our residents still have a lot of concerns, but we also recognize that things do need to start being able to move forward. Our goal is to move forward in the best way that we can, fully recognizing no plan put forward is going to make every Missoula County resident happy. However, we have to pick the plan that best protects the public's health while finding a balance with our other concerns. So here is the opening timeline. Yesterday, the stay-at-home directive expired for individuals and places of worship. Today, non-essential retail businesses may reopen with curbside pickup or delivery only. They can use our plan template located on our Guidance for Businesses page to figure out how they can do in-store services safely. On May 1st, the retail businesses with plans for operation may provide in-store business except for those given later opening dates by the governor or by local order. These businesses must meet Missoula County's requirements. Each business must limit the number of customers to 50%, provide social distancing measures, employee health screenings, and exclude ill employees. On May 4th, restaurants, bars, distilleries, breweries, and casinos can provide service in dining areas, providing that they abide by the prevention measures that are outlined in the governor's directives. On May 7th, local school boards can decide to reopen. Personal care services, massage therapy services, body art, and piercing services all remain closed until the governor's phase 2 or a change in local order. Essential businesses that operated during the governor's stay-at-home order will need to provide the same protections as the non-essential businesses. We've had several people reach out to us about reopening our local schools. The decision is up to each school board. Please send your comments to them, as they are the ones who are going to need your input when they're making those decisions. So the last thing I wanted to cover is that the CDC expanded the symptom list for COVID-19 this weekend to include chills, repeated shaking with chills, muscle pain, headaches, sore throat, and loss of taste or smell, in addition to the other symptoms of cough, fever, and difficulty breathing. We will have our medical team review this expansion and let you know how this affects our local testing clinic in the next couple of days. So that's it for my daily briefing. Again, thank you to everyone in our Missoula County communities that is working to help us prevent the spread of this disease. And thank you for your patience as we try to reopen things slowly. We will definitely keep you notified as things start to change in our community. So as always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. Click that little notification bell to be notified when additional videos are uploaded. You can follow us on Facebook under the Missoula City County Health Department. You can check out our website at missoula.co/cvirus. And you can call 258-INFO for additional information, or if you would like to schedule an appointment for a test. Stay healthy, everyone, and I will talk to you again tomorrow.